Okay. Hello, my name is Fernanda Tour,
I'm Janisha Taylor.
My name is Marlena Daca.
and this evening we will be presenting our study on ADL intervention protocols for stroke rehabilitation. So, a little background, stroke is a significant health issue that impairs individuals' ability to perform activities of daily living, with symptoms varying depending on the affected parts of the brain, but generally including weakness or numbness on one side of the body, dizziness, sudden falls, temporary vision loss, speech difficulties like aphasia or dysarthria, motor impairment, all of which can impact an individual's quality of life. So, the problem. Stroke often limits individuals' ability to perform ADLs, reducing independence and quality of life. Despite their importance, there is a lack of standardized ADL intervention protocols in occupational therapy. Therapists face challenges such as limited time, resources, and unclear guidelines, especially for newer clinicians. These gaps lead to inconsistent care for stroke survivors across settings. The purpose of our study. This study aims to understand how OTs select and implement ADL-based interventions for stroke patients. Understanding this process can help improve therapeutic approaches, enhance patients' functional outcomes, and guide Novant's clinicians in their clinical decision-making. Objectives include number one, recruit 10 participants, two, collect and analyze data from interviews. I can't see the bottom. Oh, sorry, three, report data using coding and themes.
The method for our qualitative study was to gather 10 participants. We actually gathered 30. They had to be OTs or OT students. Most of them aged between 24 through 50 years old, and they could have been in various clinical settings. The data collection tool that we used was the Google survey generated on Google Forms. There were 12 questions, nine of them were multiple choice, and three were open-ended. And then we also conducted six face-to-face interviews. The qualitative analysis was then coded and then themed to generate the overall analysis of the paper. The demographics of the participants in our study were again OT students and occupational therapists who had been in the field for at least 2 years and from the ages of 24 through 50. The discussions that we found from our study was that the findings from the study revealed majority of participants have been working with stroke patients for less than 5 years. It was also biased results due to the lack of experience, confidence level, and use of ADL interventions during treatment plans that also hindered the results. Based on the data that we collected, one can conclude that treating stroke patients is a challenging demand for OT clinicians overall.
Some su some future implications would be develop a more flexible, culturally adaptive ADL protocols. It also would be increase access to low-cost adaptive tools and community-specific interventions. Another thing that we could do is conduct further research with diverse, experienced participants. Now, the results that we came up with, the first question that we had was, what factors influence your choice of ADL interventions for stroke survivors? And the themes that arose from all the coding was length of time since stroke, severity/type of stroke, motivation of patient towards goals, patient social and environmental factors. For question two, what challenges do you face when implementing ADL-based interventions for stroke patients? The themes that arose were support system, motivation during the hard times, and legal or personal limitations. For question three, what improvements or changes would you like to see in ADL intervention protocols for stroke rehabilitation? The answers that arose were time seeing patient, standard protocols, and user-friendly interventions and inclusiveness.
For the quantitative portion of our study, we did have nine overall questions provided in the QR code down below. However, on our actual poster, we have three of the three questions that yielded the most results. Question one was, how confident are you in selecting appropriate ADL interventions for stroke patients? Majority of participants said they were slightly confident or overall confident in selecting interventions. Question number two asked, how accessible are standardized ADL intervention protocols in your workplace? 38.7% of participants said they are very accessible, that they're easy to find wherever their setting is. 26.7% were neutral, meaning they were in between those protocols being accessible, and then half of the others saying not so much. And then our third research question was, how effective do you believe ADL-based interventions are improving stroke patients' functional independence? Overall, 40% of participants said very effective.
And that's it. Thank you so much for viewing our poster, and I hope you appreciate it.
Thank you.